I'm Kristen Dawson. I'm a general surgeon at Medina Hospital. I actually grew up in Medina and went off to do my schooling. And then I came back to Medina in 2001 to join staff. And I've been there ever since. Actually, this is my only job that I've had. So it's
Perfect.
been phenomenal.
Yes. And so we do ask, why Medina Hospital over other area hospitals?
Honestly, the biggest thing was the fact that I grew up here and my dad was an orthopedic surgeon here for 30 years. And that really was probably the impetus for me to come back and work here. I looked at other places, but I am so glad that I chose Medina. It's just been such a great place to raise my family and to practice. So, and
Absolutely.
fantastic partners that I joined here at Medina, and it was fantastic.
So you've been with Medina for quite a while. What changes have you seen at Medina Hospital in the years that you've been practicing?
So the biggest change by far has been obviously the Cleveland Clinic coming in and joining with the hospital and bringing a lot of changes, which honestly they've been good and bad and struggles, but they've overall I would say has been a great addition to the hospital. They brought a lot of resources, a lot of expertise to the hospital that we didn't have before, and I think it's been a good change that we've had to weather through. But now we've been with them for 15, 16 years, so it's
Right.
been
Yeah.
it's been good.
Good. Good. And as a general surgeon, you have, I'm sure, seen changes in your specialty over the years. Are there any
Mhm.
changes um, that are either you really do appreciate or maybe see as not such a good change?
I would say the biggest change with general surgery has been the minimally invasive procedures that we're now able to do, which in my training back in the 90s and early 2000s, I did, that was just on the cusp of things happening in general surgery as far as the minimally invasive laparoscopic surgeries, doing less surgery for certain things, especially like breast cancer. We're not doing as much surgery, not as indicated. So I think that that's probably been the biggest change has just been faster recoveries and um, less pain.
So, also, just in medicine in general, what changes have you witnessed?
Several. I would say the biggest change that I've been most appreciative of has been just the advances in oncology and the um, kind of rheumatoid type diseases with chronic inflammation and things like that, where we've learned how to, with medications, we've learned how to manipulate our immune system to help fight cancer, to help minimize inflammation, things like that, to help with those kind of diseases. That's been pretty phenomenal in the setting of oncology. As far as other things, AI, that's kind of been a newer
Hmm.
addition to our practice for the past year, almost a year. Um, Huge game changer for us from a surgical stand or from a patient care standpoint. Just getting our notes done, being able to sit down with a patient and be able to have a conversation with them without having to be on a computer. A lot of it is just being recorded, and then you're just helping with your notes. It's not taking the place of my job, but it's just certainly making my job much easier.
Perfect. We've had the discussion about AI with many.
Hmm.
Are there any concerns that AI brings to your specialty or to medicine in general?
I would say if you're using it to replace the human aspect of it, that's where it's going to go wrong. Because even in our notes, it doesn't always get it right. You absolutely have to review it and make sure that everything in there is what happened and what was said, and there's no extraneous things coming in. So it does not take the place of the human factor at all.
Good, good. I know that you've had many, many interactions with patients. Are there any that have a poignant or significant memory with any particular instance with a patient?
I would say that the ones that I've taken care of on a long-term basis, that's not something most general surgeons get a chance to do. It's a lot of, you come in, you're sick, we help you feel better, and then you move on. But I would say the patients that have stuck with me the most have been, a lot of my breast cancer patients, colon cancer patients, patients that I see for years and years and have developed a relationship with. I've taken care of their kids. So it's been, I would say that those are the patients that stick out in my mind the most.
So we've talked a little bit about changes.
Mhm.
Is there something that you would think, or you would call out as the best change, either in your specialty or in medicine,
Mhm.
or even at the hospital?
The hospital. I would say, for sure at the hospital, the changes that have occurred have been, for the most part, very positive. We have, a fantastic staff. The administration, the mid levels, everyone that works there has just been so fantastic to work with, and I feel that that camaraderie at the hospital has really progressed, especially over the past 5, 7 years. Getting through COVID together, doing a lot of you know tough things together, it has been probably the best that's happened at Medina Hospital over the years. But
So we've talked a lot about positive changes. Is there any change that has saddened you over the years?
I would say that the biggest challenge has been how many patients that we take care of now and how sick they are. Um, and it's sad in the sense that our ERs are just overwhelmed. It's so hard to get patients into the hospital because it's so full. But it's a challenge that I think that Medina Hospital will be able to meet, and hopefully expand our services, be able to help more patients, because it's not going anywhere. We're always going to be full.
I
So
think so. That's so true. So you've been in practice for a while and you're a woman general
mhm.
surgeon. What advice would you give to new, either new practice, new in practice, or even thinking about becoming maybe a woman in
Mhm.
medicine, or just, medicine in general? What kind of advice would you give?
I think the best advice, and I probably learned this from my father without him even realizing it, is to really just treat your patients like their family and take care of them like you would want someone to take care of you. If you're a female looking to go into the medical field, don't shy away from the hard work, because it's worth it. It's so rewarding to, see your patients after you've taken care of them, either in the hospital or at the grocery store, and having that connection with them has just been just amazing.
So nice to hear. So talking about the future,
Mhm.
what kinds of future changes do you see either in your specialty or in medicine in general?
I think AI is going to probably, don't ask me any specifics about it. I'm not a that's not my field, but I think that's going to help medicine in general, probably the most. In surgery, there's a lot more robotic surgery happening, which from an old person standpoint, I guess it's kind of hard for me to move in that direction. But the ergonomics are helpful for us as we get older, not having to stand
Yeah.
for long periods of time. Things like that are certainly beneficial, different than what I trained with, but I think would be a positive. So I would say robotics and AI are probably the two big things in surgery.
Great. Thank you so much.
Mhm.
So, in summary, are there any other thoughts that you would like to share with the community or with those who will be participating in our exhibit?
I would say that I have been so blessed to be working in this community, in this job, fantastic partners, being able to work with my dad for 5 years. I mean, it's been just a fantastic opportunity to not only work at Medina Hospital, but to also, again, raise my family here. They actually all went to the same schools that I did and have almost all graduated. But they're it's just been a great experience for me.
Perfect. And speaking from personal experience, it's been a great opportunity to actually
Aw,
have worked with you as well.
yeah, and you too.
Any other comments or questions? Any other thoughts? All right. Thank you
Okay.
so much,
Yeah,
Dr.
thank you.
Dawson.
I appreciate the opportunity.
Thank you.
Good.